I'm a Bloomberg Fellow.
I am a Bloomberg Fellow.
I'm a Bloomberg Fellow.
And I'm a Bloomberg Fellow.
I'm a Bloomberg Fellow.
And I'm a Bloomberg Fellow.
I'm a case manager for people living with hepatitis C.
Director of Suicide Prevention.
Historian and preservationist.
Detective with the Threat Response Unit.
An attending physician in the emergency department.
I work at the White House Office of National Drug Control Policy.
Bronx Connect.
Fort Lauderdale Police Department.
Get Healthy Philly.
The Hawaii Department of Health.
Food and Water Action.
I became a fellow to make sure addiction is seen as a disease.
I hope to do my part in ending youth homelessness.
I became a fellow to find new ways to address the effects of vacancy and abandonment.
I hope to reshape the food system to promote community and ecological health.
I became a fellow to strengthen primary prevention of human trafficking.
I hope to collaborate toward solutions that are bigger and smarter than what we are up against.
To promote social justice for people who use drugs in marginalized communities.
To promote mental health and decrease risk among minority youth.
To help reduce our nation's gun violence crisis.
To attack the true root causes of unhealthy environments.
Join us.
Join us.
As we work to save lives.
And build a healthier future for our country.
And build a healthier future for our country.
Hello, everyone. Thank you so much for joining us today. We are excited to have you on this live talk about the Bloomberg American Health Initiative. And for those of you who are watching the recording on our YouTube channel, thank you for also finding us and learning more. We are here for the Bloomberg American Health Initiative Bloomberg Fellows webinar series. Today, we'll be talking more about the adolescent health focus area. My name is Shane Bryan. I'm the Partnership and Engagement Officer with the initiative, and I'm joined here in studio with my colleague, Faria Zaman, who is the Fellowship Officer with the initiative.
Good afternoon, everyone. It's great to be here, Shane.
Yes, and we are very excited to have everyone joining us. Also online, we have a few of our colleagues, Emily Witkowski, who is with the Maplewood Memorial Library and was one of our Bloomberg Fellows, Sarah Lester, the director of the Maplewood Memorial Library, and Kristen Mari, who is a faculty member here at the Johns Hopkins Bloomberg School of Public Health. We'll hear from those folks in just a few minutes. If you have any questions throughout the time that we are hosting this session, please email us at bloombergfellowsmph@jhu.edu, and we will answer your questions at the end of the session. So be sure to log in and let us know what questions you might have. If we don't get to all of them, we'll be sure to answer your emails offline. So just to give you a sense of what we're going to be talking about today, we'll dive a little bit deeper into the initiative, how we were founded, where we are today, the focus areas, our cross-cutting themes, the approaches for our work, and most importantly, we're going to talk about the Bloomberg Fellows Program, why you all are joining us, and the adolescent health focus area. Let's start off by talking about our history. We were launched in 2016. This was during a time when the United States had seen a life expectancy decline for 2 straight years. The leaders here at the school and at Bloomberg Philanthropies identified 5 key areas for us to focus our work and energy to improve and change the health of America. Those 5 areas are called our focus areas, and they are addiction and overdose, adolescent health, obesity and the food system, environmental challenges, and violence. Now, it's important for you to know we take a very broad approach when we're thinking of these 5 areas. So using violence as an example, it certainly is gun violence, intimate partner violence, but also structural and community-based violence. For environment, it's climate and climate change, but it's also how a community's built environment is affecting those individuals who live in that community. So for an adolescent health, this is the only focus area that's focused on a population. So the young people who are growing and coming through adulthood, we want to make sure that we have opportunities to know and learn more about the experiences that they're having, particularly for at-risk youth. But we'll talk about that a little bit more with our fellows and our faculty member who's joining us today. So those are the 5 focus areas. Now let's talk about the cross-cutting themes. Equity, evidence, and policy. These are the themes of the initiative and are found in all of the work that we do. For equity, it's about ensuring that we are working in all communities across the country, urban, rural, suburban, and are engaging with individuals with a diversity of lived experiences. For evidence, it's all about the data, ensuring that we're using high-quality data to inform our practices, our policies, and providing our decision makers with that data to influence the way that they make their decisions. Policies is about national, state, and local policies, but also the organizations, and an understanding that those policies that your organization has greatly influences the way that you work with your community. All right, so we have our 5 focus areas, Faria. We have the 3 cross-cutting themes.
Right.
Next, we have the approaches. So we have research, practice, and education. For research, we're funding and supporting faculty to work with and collaborate with communities all across the country. It's impact-based, so meaning we certainly value research articles and having opportunities to read and learn more about the work that researchers are doing. But for us, it's all about ensuring that we have programs, toolkits, things that can be transferable from one community to the next. For practice, it's about supporting faculty. We are endowing 25 faculty positions, 5 in each of the focus areas across the initiative. These are individuals who are taking innovative approaches to their work, supporting fellows and organizations, and working in communities to address the issues of the initiative. All right, so we know that you came on today to learn more about the Fellows Program. So Faria, do you want to talk a little bit more about the Bloomberg Fellows Program and the information folks should be aware of as they're considering to apply?
Absolutely, Shane. I'm so excited to tell you all about this amazing fellowship program. So the Bloomberg Fellows Program, it's really unique, it's impact-based, and we're looking for those individuals who are working on the front lines of the 5 focus areas. Fellows center their studies around their focus area. They engage with their organizations, and once they complete the MPH degree, they will fulfill what we call the service obligation, which is to work with their organization for at least 1 year following graduation. And the organization, in turn, is participating in a vast national network of other organizations. And I do want to let everyone know that all organizations are eligible for the fellowship, whether it's a governmental or non-governmental or a small community-based group, as long as the organization is based here in the U.S., working in at least one of the 5 focus areas, they are eligible. And Shane, I thought you could talk a little bit about the national network.
Absolutely, absolutely. So we currently have organizations all over the country. As Faria mentioned, nonprofit, governmental, non-governmental organizations. And this network is bringing all of those players together who are working on a variety of issues in their particular community and providing opportunities for collaboration, sharing best practices, networking, and working with faculty or other fellows through the initiative. Now, what we're particularly interested and excited about through this network is we're bringing together both your traditional and non-traditional public health groups and individuals. So this might mean, as we'll hear about later today, or in just a few minutes actually, our colleagues who are with the library system. How is it that they are working on the front lines of public health, and how can we partner and share their resources and best practices with other organizations across the country? And then also we bring folks together through this network in an annual convening called the Bloomberg American Health Summit. This is an impactful 2 days where all the fellows, organizations, faculty, and thought leaders from across the country come together to discuss these 5 focus areas and how we can improve the health of communities by working hard together in impact-based opportunities. So it's a mutually beneficial opportunity for you. It's talking about ways to connect the organizations, fellows, and faculty in the school together. It's not just the fellows getting an educational opportunity or thinking about ways to get another master's degree. It's really about building this network and finding ways for collaboration.
That's right, Shane. It's as much for the organizations as it is for the fellows.
Absolutely. So another really popular question we always get is, Is there a difference between a full-time, part-time program, or how should an individual make their decision when they're considering to apply? You want to talk more about that?
Yes. So the fellowship program is open to both full-time and part-time applicants. For the full-time, you would be based here in Baltimore for 11 months, and you would do the program from June through May. And the school has 5 8-week sessions. So it's very intensive, and you complete the entire degree in 11 months. You can also choose to do it part-time. So on a part-time basis, the students have up until 4 years to complete the program, and typically you can complete it in around 2 to 3 years. And online, almost the entire degree is available online. And you can access those courses from anywhere you like. And as part of being a Bloomberg Fellow, we require our fellows to do at least 16 credits here in Baltimore, even if you are part-time. And that's because we want to see you. We want you to have opportunity to meet with your classmates, to connect with the faculty and the initiative.
Yeah, so one of the things that I feel the students, as they're considering to apply, is what's the best option for them. And I think as you think about this opportunity, talk to colleagues. You can always connect with Faria or others here at the initiative to talk through what might be the best fit. But a great majority of our fellows do it part-time. They continue working in their home communities and being with their families or other commitments. So it's great that that option is available to both.
Yes, it's very flexible.
And so, Faria, some of the courses here at the School of Public Health are second to none and very innovative in the things that they're learning. And I know that you have some examples you would like to share.
Yeah, I do. So here is just a sample of some of the courses that are offered in the adolescent health focus area. Now, students have several electives that they can take, and so you have many courses to choose from if you happen to be in the adolescent focus area. For example, maternal child health, to family violence, to children in crisis. So you have a lot of good options here. I'd like to take this moment to introduce one of our amazing Bloomberg Fellows, Emily Witkowski from the Maplewood Library in New Jersey. Emily, thank you so much for being here with us today. It's great to have you.
Thank you guys so much. I hope you can hear me. I know there's some background noise. My teens are outside there.
No, we can actually hear you very well, Emily. You know, I wanted to start off just asking you to tell us about the kind of work that you're doing as a librarian at Maplewood.
Sure, yeah. So my title is I'm the teen or young adult librarian here at Maplewood Memorial Library. And what that means is my service group is middle school and high school students. So I do all the traditional library things of ordering books and designing after school programs and collaborating with our community. But I'd say the majority of my time and the biggest kind of important part of my job to me is spending every day after school with about 50 to 80 middle school and high school students. So we're directly across the street from the middle school and less than a mile down the road from a high school. And every day, like I said, we have about 50 to 80 students here from 2:30 to 6 or 7. And they come here to do homework, but also to seek refuge, to avoid going home in some cases, to be with friends, a variety of reasons. So we're sort of here as a support for them.
Okay. Wow. It can't be easy being there with 80 middle schoolers, I'm sure. Emily, can you talk a little bit about how you manage working full-time and taking your courses as a part-time student?
Certainly, yeah. So I actually find it's really been enriching doing it part-time and doing it while I'm still working, because I can immediately apply things into work, and I'm reading things in lectures or in assigned readings and being able to apply them right away to my work in my job. So it is sort of tough. There are certain crunch times that you find that you're sort of overwhelmed, but I'm very lucky to work in an organization that has been helping me to find time to do an assignment or to take an exam. So I've been really lucky to have a very easy to work with organization.
That's really great to hear, Emily. You mentioned applying some of the things you're learning in your courses to your everyday job. Could you talk a little bit more and elaborate on that?
Sure. So recently, one of the big things I've been thinking about is I just took a course in the Winter Institute on program planning for health behavior change, and sort of how do we design programs to better affect change in our communities. And I think that that's so in line with what I do on a daily basis. How do I implement programs for the teens here in Maplewood that are going to impact their lives and hopefully in a very beneficial way. So I've been able to do some of the work that I did in that class and kind of carry it over into my work here. Even just learning about some of the psychological and behavioral factors that impact behaviors and health behaviors, that's been really huge. Understanding a little bit behind why adolescents do the things they do and sort of the brain work and psychological work behind that. So it's been really enriching to learn that as I'm working.
Wow, that's fantastic, Emily. That is so great to hear. Thank you so much. I think now, Shane, would you like to move on to?
Yeah, I can connect with Sarah. And Sarah, thank you so much for joining and calling in to the webinar today. Sarah, if you wouldn't mind just sharing a little bit of a background on your work and your work with the library system.
Sure. So as Emily said, I'm the director of the library, and I have the privilege of working with a group of more than 30 really incredible people, including Emily. And when we saw this opportunity, that was advertised through the state library, an opportunity to get involved with the Bloomberg Fellowship Program, we thought it was an immediate connection for us, because so much of what we do is public health related. We have over 1,000 people walk through our doors every day, and they have all kinds of issues and all kinds of needs. And so our librarians really do, as Emily said, we do traditional librarian work, but we're also doing a lot of hands-on work with people in really incredible need. So we feel very lucky to have Emily being a part of this program.
Absolutely. And one of the things from you sharing that I just really want to highlight for our listeners is the work that you all are doing. The listeners who are online or watching this recording might be a completely different career field. And we want you to understand that public health is a lens, a way of doing your work. So we're excited to have the library system as one of our partner and collaborating organizations. And Sarah, can you just tell us a little bit about what, as a contact or as a collaborating organization, what your experience has been like so far?
I think it's been overwhelmingly positive, and I can start with just having Emily go, taking classes, coming back to talk to me and to our colleagues, being really inspired and engaged, and bringing back, wonderful ideas to share with us and ways to improve our services, to also being part of the summit. And that was so inspiring for me to be surrounded by so many really, kind of leaders in their fields, and really gave me, lots of different ideas and thoughts of ways that we could improve things at our library, and also how we could use our library as a model for other libraries across the state. As I understand it, Emily is the first librarian to be part of this program. So it really is, a new connection that has been made here. And so we are looking at ways that we can share this with other libraries on a national level.
Absolutely, and we are grateful for your partnership and for you all to see the opportunity and take a hold of it. And you talked about this a little bit with Emily taking courses and sharing that learning with you all, but are there any other benefits of having a colleague be a Bloomberg Fellow that you would like to share with the listeners?
Well, I think, Emily's focus area is on adolescent health, but I think all of the 5 focus areas touch us at the library. So I think, we've, just being exposed to sort of the learning involved in all of those areas has been really, really helpful for us. And I think, just sort of piggyback on what Emily was saying, I think, to her credit, I think partly through her experience and her learning through the Bloomberg, Fellowship, she has grown the teen population at the Maplewood Library. So whereas we used to have mostly middle school age children and students come to the library, now many high school students come to the library because of Emily and because she is so engaged and interested in the teens and how they're doing and really trying to, help them learn and grow and become better people. And I really do think that is, partly due to, her experience in the public health program.
Wonderful. Thank you again so much for sharing your feedback and to sharing this information with our listeners and the folks who are watching the recording. I know that there are people who are out there seeing this right now thinking, is this really a good fit for me? And we think it probably is. Let us know, connect with us, reach out to Faria or others on the team, and we can certainly talk about your experiences and how this could be a good fit for you. So next, I want to introduce our faculty member who's joining us today, Kristen Maury. Kristen is an associate professor here at the Johns Hopkins Bloomberg School of Public Health. Her affiliations are with the Department of Population, Family, and Reproductive Health, the Center for Adolescent Health, the Bill and Melinda Gates Institute for Population and Reproductive Health, and others. Her research focuses are in adolescent health, risk and protective factors, implementation research, and gender norms. And I know there's others that are a part of the work that you do, Kristen. Thank you so very much for joining us. And can you tell us a little bit about your work here at the school?
Sure. So as you mentioned, I do both international and domestic work. So I actually started off more into kind of global adolescent health. And then I did a study not too long ago in which Baltimore was one of the sites, and we compared the youth here in Baltimore with other youth in a slum in India, an inner city in Johannesburg, migrants in Shanghai, and we found that actually there was a lot of issues here in Baltimore that were not only similar in some of these locations, but even worse. And so that really changed a lot of the focus. And so now I've been doing a lot of my work here in Baltimore, especially, and particularly among vulnerable populations. One of the things we did when we started the adolescent health focal area, my colleague Tamara and I developed a youth advisory board. And they're a group that has now grown up to 26 members. And they're all from here in Baltimore. And they come every other week. And we discuss issues that they really want to address. And it's been a very powerful part of all of our work. So a lot of the research that we do, even though it's not part of the initiative, but other parts that I do with the Center for Adolescent Health and even internationally, I often include them just to get their advice, their recommendations for the next steps. And so that's been a really important part of my work here. I would say I probably concentrate most on looking at social contextual factors related to health outcomes. And I do that in a variety of different ways. So the outcome can vary, but I really pay attention to the family life, how that contributes. I pay attention to the neighborhoods, especially. I'm doing some new research on that. The peers. And then I take that information and I like to apply it. So a lot of my work is focused on evaluations. So I learn a lot from the research and I apply it to the kind of the design and what do I need to know to look for in a program to make it successful. So I teach one of the core evaluation classes here at the school and have done a lot about trying to figure out what works in terms of adolescent health programming.
That's wonderful, and evaluations are always critical to the work and ensuring that what we are trying to do, we are actually implementing and being successful at. So we greatly appreciate your work and your focus and sharing that with others. As we discussed earlier in the session, adolescent health focus area is the only focus area of the initiative that is population-based. So Kristen, can you talk a little bit about why it's critical for us to focus on this particular developmental stage for a young person?
Yeah, I would be glad to. I mean, first of all, this is one of the most critical developmental phases. This is a period of our development where a lot of things are forming. So even in early adolescence, this is a time when they're starting to figure out what's different from them, from their parents. Parents are starting to lose a little bit less of an influence. Peers are starting to take more of an influence. So there's a lot of things that are going on in their lives, and they're trying to navigate all these different mixed messages. So one of the studies I'm working on is looking at gender norms and how that influences health. And you think about all the different ways that adolescents are getting messages about what is expected of them in terms of being a boy and girl and all of these other things. So we're learning about that and trying to help adolescents with that. But if you think of other health outcomes, so a lot of the behaviors that we find in adulthood actually start in adolescence. So mental health, a lot of those symptoms start developing at this time period. A lot of the risk behaviors, experiments start here in adolescence. So with smoking and drugs and sex, all of those things start at this stage. So there's a great deal of opportunity then, that means, that we can deal with. If we can start working on and figuring out those factors that protect adolescents from engaging in a lot of these risk behaviors, and then those also that we know that increase their risk, we can work with programs to know how to build up those sort of protective factors and really give them assets to work with as resources for a lot of these improved health outcomes. So it's a very critical period, and I think it gives us a lot of hope that if we can address a lot of these factors that start here, we can also think about that as also improving their adulthood trajectories.
Absolutely. And another component of the initiative is finding ways to support faculty who are doing this work. And I know that there's a relatively new project that you've been working on through some support here at the initiative. Kristen, can you give us some insight and share some exciting information that you have with that particular project?
Yeah, so one area that I actually really had not studied before this initiative was food insecurity in adolescents. So this actually happened because of the symposium that Tamara and I launched to launch this area as part of the initiative. And one of the participants that was coming shared with me a report on food insecurity that they had done. And so I read through it, and it was really surprising. And so I started to think about, well, has this type of work ever been done in Baltimore? And I looked and I found that there was nothing. So I applied for a small grant through the Bloomberg American Health Initiative and received it. And basically what we wanted to know is, do adolescents here experience food insecurity, and how do they cope with it, and what do they recommend for dealing with it? So I actually trained members of our youth advisory board that I told you about to be the researchers on this. And this was a topic that was also important to them. And so we selected 6 neighborhoods in Baltimore. And basically what we found was really surprising. And in fact, that adolescent food security is not only a problem, but it's very widespread in many neighborhoods here in Baltimore. But adolescents don't like to talk about it because it's a very stigmatizing topic. And so some of the things that they told us was that it was easier for them to actually, especially for the girls, to engage in transactional sex to get money for food. For boys, they said that they would actually shoplift or sell drugs to get money for food. These activities or these behaviors were far easier for them than it was for them to go into a soup kitchen or a food pantry where they were going to be sometimes harassed. And then it also allowed them to give choice. With the money, they knew exactly where they could go to get food. So this really surprised me. And I asked the youth then, as part of this, well, what should we do about it? And they said, well, because it's so stigmatizing, whatever you do, it can't be seen as just a food only type of issue. So any program has to address the broader economic issues. So pairing it with a job services training program would be something that would attract youth. It cannot be seen as this food only type of program. So anyways, I took those findings and I went to the city with them. The city of Baltimore. And I talked to the food policy director, and surprisingly, she did not know about this issue. So she told me, she said, well, can you develop a blueprint for the city for how we can address this? So I talked to the director of the initiative, Josh Sharfstein, and he said, okay, why don't you apply for a mid-year funding grant? So I did, and I got it. And I worked with some doctoral students, and we developed a blueprint. And now it's interesting that the blueprint is actually being implemented in the city. In fact, there are some meetings happening this Friday to go through the blueprint. And also because of our work, the city has applied to get funding from the state to implement a pilot program to test the impact of adolescents getting summer SNAP benefits. Now, the summer SNAP benefits go to the household, but they really want to see to what extent do adolescents benefit from that. So they are asking me to lead the evaluation. And again, I've applied for funding through the initiative to see if I can get those funds to do the evaluation. So again, this all happened from this small study that I got, this grant through the initiative, but it is really just expanded into this whole area now, both in terms of policy and programming.
That's wonderful.
That's amazing.
And we're really
Kristen,
excited.
Really, that's so impressive. That's fantastic.
It is. And Fari, I think one of the things that I get really excited about is hearing how through the support of the initiative, either through the fellows or the organization or the work that our faculty are doing, we're seeing change happen, right? Like the city of Baltimore has bought in and is taking it further. It's a project that they are proud of themselves. And this is the youth of Baltimore who are helping to inform our policymakers. And that's what it's about, thinking outside of the box and getting everyone involved, not just the fellows or just the organizations, but the entire community where folks are. So Fari, I think that people are anxiously waiting to hear how they can become a part of this amazing work and how they can apply.
Yes, and I'm excited to tell them. So I'm going to talk a little bit about how to apply to the fellowship. So applicants would need to apply to both the MPH program and the fellowship together at the same time. And for the MPH program, you would start by going to their website. They have very explicit instructions on how to apply to the MPH. You have to submit all of your admissions materials through SOPHIS, which is the name of the application processing system that the Bloomberg School uses. So all of your transcripts, your letters, essay, everything will be submitted through SOPHIS. And at the same time, you would go to the fellowship website and you would download our 2 fellowship application forms. There's one for the applicant and one for the organization. And both of those forms must be completed and also submitted right on our website. So you would do both the MPH and the fellowship application at the same time. And I want to tell everyone that the final deadline to submit both your MPH admissions materials and your fellowship application forms will be December 1st. And so all of your materials, they have to be submitted by then.
Wonderful. And before we get to your questions, so I know that folks have been sending in questions throughout this recording or even beforehand. If you have a question right now, go ahead, get onto your email, bloombergfellowsmph@jhu.edu. Send us a question and we'll do our best to get to it on air. If not, we'll be sure to follow up via email. Next, we want to share with you a very brief video of one of our inaugural fellows, Monica. Enjoy.
Action News is investigating the scope of the truancy and dropout problem.
A growing number of homeless people in the U.S. are children and teenagers.
Almost 1 in 10 students dropped out in a single year.
The immigrant population in the U.S. is projected to grow exponentially in the next 25 years, and we are not prepared to receive them. Most of these kids are first-generation U.S. citizens, and their parents have not been to college. Most of them have not finished elementary school. Thanks to the Bloomberg American Health Initiative, we have had a youth program for 4 years now. Your brain has to be really focused. The mentoring program started because these adolescents came to us asking questions about how can they work on their math problems or the science class or the English class. And these opportunities don't let them fall through the cracks. We give them a hand so they can thrive despite the many challenges that their families face. I've seen youth who came to us very hopeless, and after working with them for a couple of years, they became college students. It is important that we build this network in this community, and the way that we do it is through partnership with local organizations to be the facilitators for these youth's success.
Wow, that's such a fantastic video, Shane. I love that. So that was Monica, who was part of our inaugural cohort of fellows and also one of the very first fellows to graduate, and she's doing amazing work.
She really is.
She is. She's great. So Shane, I think you have some questions.
We do. We have your questions. We are so excited that you all have sent in some really good questions for us. And I know we're not going to be able to get through them all, but again, we will respond to every question we receive via email. Fari, the first question I'd like to ask or pose to you, this particular individual it says here they've been out of school for a number of years, and they are interested in applying, but they're nervous to both go through the application process and, since it's been so long, being a student again. Can you talk a little bit about that?
Yes, and that's a great question. I want to tell everyone that most of our fellows have not been in school for 10 years and even 15 years. So please don't let that discourage you or make you nervous in any way. We are here to help guide you through the application process. So if you have any questions, you should always reach out. Don't hesitate. But for people who have been out of school for a long time, Shane, it's important they start the process early, because you have to take your GRE and you do have to take some prerequisites which are required by the MPH program. So the earlier you start, the better. And I would suggest you first reach out to the MPH program office, and they will be able to guide you on GREs, the kind of scores they're looking for, the kind of prerequisites that you would need to take. And then when you begin the process, you should reach out to me as well, and I'm happy to guide you through the fellowship application process as well. But do not feel discouraged. We are here to support you.
I think the next question might be a good one for Emily, if you wanted to.
Oh, yes. So, Emily, a lot of people have emailed about concerns about going back to school or doing the MPH degree when they don't have a traditional MPH background. Could you talk a little bit about some of the support that is available to Bloomberg Fellows?
Certainly, yeah. So I know one of the big things that that you guys are so helpful in providing for us is tutors. So I have a bunch of my friends that were in my statistics class. A couple of them were using tutors, but also the fellowship itself has been such a unique group. I rely a lot on my fellows. I mean, a bunch of us met in our first class together, and we really kind of have stayed in touch and emailed back and forth and taken classes together and met in groups to study and everything and virtually. So it's really been just having that group of people together has been really invaluable as a student returning to school.
Okay,
That's great.
That's helpful. Thank you, Emily.
Another question we got here is, maybe Sarah, if you have an opportunity to share, some of the folks who are writing in are asking, how can I convince my organization, or what are some things my organization should know before applying to this opportunity? So Sarah, you touched on it earlier, but any thoughts that you want to share with others about the benefits, or what they can share with their supervisors or their organization about the opportunity?
Yes, I'd love to. I guess from the start, I only saw this as a positive for our library. Emily is, she's doing this part-time, so she's working full-time at the library, but she does have to go on campus, a couple times a year. Just because of the benefits of what she's bringing back, I think it's been, everybody here at the library has been very supportive of what Emily is doing, and really sort of realizes the importance of it and the value in it, that the time away from the library has not been a problem for us at all. We also, because we know what the benefits of this, we allow Emily to do some of her assignments on work time, to have a flexible schedule if she needs to do anything really that she needs to do. And she's been able to do that while still maintaining a pretty regular schedule in the teen zone. So she's always there for our teens between 3 and 6. So I think that's pretty incredible.
It is. And I think for one of the things that we hear from many organizations is, because the work is so relevant to the schoolwork is so relevant to their daily work, that there is great benefits that the organizations have experienced and things that they haven't even necessarily considered. So for those of you who are tuning in and this might be a concern of yours or something that your organization is asking a lot of questions on, we're more than happy to connect. You can always reach out to Faria or myself or anyone on the team, and we can have those conversations and talk to you or your supervisor about what this initiative means and how folks can be involved. So I think moving along in that particular realm, Faria, another question that we got in is, are there, first of all, any restrictions on the types of organizations who can apply? I know you talked about this earlier, but you wanna catch that one again?
Yes, sure. So there aren't any restrictions in terms of what kind of organizations are eligible. So basically, as long as an organization is based here in the U.S. and is working in at least one of the 5 focus areas, they are eligible. And as I mentioned before, it can be a government agency, it can be a small community-based group, it can be a school system, it can be a library, it can be a hospital. So there aren't any restrictions. It's really wide open, and we would love to bring in many more non-traditional students like Emily.
Yeah, we are very excited to have the library system a part of this, and you all have been wonderfully active in the work. And I think just another thing that maybe
Shane, actually, I was just going to say, can you talk a little bit about how the organizations are engaged with the initiative?
Absolutely. So through the initiative, the organizations have a variety of ways to be involved. We don't have a set required number of meetings that you have to attend or emails that we expect you to respond to, but rather how can we meet folks where they are? How can we partner with you in a mutually beneficial way, connect you with faculty who are doing innovative and amazing work? Or if there's a particular, very specific question that you have, you would just connect with us and we would do our legwork to connect you with the thought leaders here who can help you answer those questions. Other ways organizations have been involved, Faria, is through collaborating grants, working with each other or faculty on particular projects, and certainly supporting the fellow. It's important for us here at the initiative to know that the organization is going to be supportive and that they're interested in being a part of this network and this movement of improving health throughout communities. So thank you for that question. And I think we have time maybe for one or two more, Faria. So another question I have here for you is, what if I don't make it into the MPH program when I apply?
Okay, well, that's a good question. For those applicants who may not be admitted the first time around, you should reapply. It's absolutely possible to submit your application again. And I would suggest speaking with the MPH program office, and they are great with giving guidance on how to strengthen your application if you decide to reapply. So don't be discouraged, and you should definitely try again. Very much worth it.
Yeah, absolutely. And I think the final question, looks like we're getting really close to time, but Kristen, I wanted to get this question in because we just had someone send in a question about how are ways in which students or fellows, quite frankly, able to work with faculty. I know you talked about how you've worked with some of the students here at the School of Public Health on some of your projects, but do you have any other thoughts on ways in which students or fellows can connect directly with the faculty?
Oh, definitely. There is not a shortage of opportunities. In fact, I think what it is that students have to often say no because there are so many different research and policy and even practice initiatives going on that there is just a plethora of ways to kind of engage. It really depends on the student as to what kind of skills he or she wants to try to get out of this. What are the types of topics that are of interest? So adolescent health covers a wide variety of different health outcomes. So it's really mainly up to the student, I would say, to get in touch with a faculty member and find out what the work that faculty member is doing. And chances are there's going to be an opportunity. I have several students and I'm looking for several more all the time. So yeah, I think that there's no shortage with those types of opportunities here.
Absolutely, I agree.
That's great to hear.
Yeah. Folks, I'm so sorry. I know there's questions still coming in. And we greatly appreciate your excitement and your interest. Faria and I will go online and we'll continue responding to questions, but we're running short on time, so we want to make sure that you find ways to continue to stay connected with us. We have a weekly newsletter called the American Health Dispatch. You can go on our website right now and subscribe to that newsletter. It goes out every Friday with amazing resources or articles on the 5 focus areas and news about the initiative. That's where you're going to hear about the application becoming available in August. While you're on our website, go ahead and look around, check out the other focus areas, see some of the research projects and the toolkits that are available there for you now as just a general member or individual on our website. There's a number of really great resources that you might find applicable to your work. Our YouTube page is phenomenal. There's a number of really great resources that are available there, from recordings like this. We will put this on our YouTube channel, but also there'll be videos there from the American Health Summit, from various seminars we've had on campus, and some of the, quite frankly, leaders in adolescent health all across the country. We have some really great videos that are resources that you might be able to use if you're a teacher in the classroom or a librarian in your after-school program. So go and check out our YouTube page. And finally, on Twitter, we're there, we're active. We promise if you go and follow us at American Health, we'll be sure to follow you right back.
Thanks, Shane. I just have one more thing to add. I want everyone to know that the next call for fellowship applications will be announced in early August on our website. So please keep an eye out, and we look forward to your applications. Thank you so much for being here.
Thank you. Have a great day.